Welcome to Talk 1260 KTRC. You're listening to the Humanity Behind the Vanity. This is Dr. Daniel Ronel, plastic surgeon, and I'm here with my wife, Betsy.
I'm back. Took a little breather.
And Lanya Deerholt, who's the district manager of Fit Weight Loss. We are going to talk about weight loss today and medical weight loss. And Fit Weight Loss operates out of my office in Santa Fe, but they have offices in many other places. So
Yeah,
tell us.
Albuquerque too.
Albuquerque and Scottsdale.
Okay, well tell us, what is Fit Weight Loss?
Well, Fit Weight Loss Center is really the weight loss program that works for everyone. It's real people eating real food, following an easy plan that really helps them reduce their daily caloric intake and lose weight every week they come into the clinic.
Wow.
Wow, how is this different from other weight loss programs?
Well, we utilize both an herbal and a prescription appetite suppressant, along with a diet that reduces their daily caloric intake. So the appetite suppressant makes it easy to stick to the diet, but it's really the diet that makes the patients lose weight.
Exactly.
Okay,
Right.
is this anything like fen-phen that got bad press?
No, it is not.
Good.
We utilize both a prescription appetite suppressant and an herbal, so if people have preference for an all-natural way to lose, they can find it here with us.
That works
Oh,
well
that's
with
cool.
us.
Yes,
Yeah, I like
absolutely.
that.
Yeah, that's excellent. What how there's this big trend. This is not one of the standard questions, but there's this big thing about the HCG weight loss.
Mhm.
When people get off that next to nil caloric intake, they gain weight again. Yours is a method to sustain it for a lifetime.
Yes, I think most of our patients are so successful because we teach them how to eat real food. There is
Exactly.
no meal replacements, there's no prepackaged foods.
Right.
We do help them with a specific diet to follow.
Right.
However, they're continuing to shop for themselves, cook for themselves, and so when they transition off once they meet their goals,
Right.
they already have all that behavior change behind them.
And that's critical. That's the key piece for everybody
Right.
who wants to change anything. It's
Yeah.
behavioral.
It is. It is.
Unlearn what you know and
Would you
relearn.
say that's the key to your success, what makes your program so successful?
I think it is. I think it's that utilizing a diet, but in conjunction with the appetite suppressant,
Yes.
because it's just kind of that jump start the patients need.
Right.
And when they have that amazing weight loss, then they get really motivated.
Yes.
Behaviorally, it kind of kicks in,
Right.
and they really stay on track.
Right.
What does somebody have to go through to get started on your program?
Well, that process is something that is fairly detailed. Patients should expect to spend about an hour and a half in our clinic the first time they come in. Yes, we do start off with an EKG to make sure their heart's healthy. We also do a full fasting blood panel to make sure there's nothing going on internally that would be contributing to their weight gain. For instance, a thyroid issue.
Exactly. Right.
Or anything that would be a contraindication with the appetite suppressant. So at that time, they discuss with either the doctor or the nurse practitioner their medical history, any medications they're taking, and their weight loss goals. And at that point, we determine which appetite suppressant is going to work best for them. After that, they actually move on to speak with what we call a fit coach. And what we do is go over the diet portion of the protocol with them, where they do, as I said, continue to eat their own foods, but we do restrict some food groups and their daily caloric intake. They'll leave every appointment with their medication. It's a weekly program, so they do have that accountability of coming back into the clinic on a weekly basis, not just giving out an appetite suppressant and, here
Right.
you go, good luck.
Right,
But
right.
yes, come back in, let's check in. You
Right.
have a coach to help you. You have,
Excellent.
medical staff to assist you all along the way.
Yeah, excellent. If you were to find there was a trauma in their life, perhaps which triggered the overeating, would you then refer them out to a therapist of some sort?
We would. Sometimes these things come up. I mean, when people lose 50, 60, over 100 pounds,
Right.
many things tend to change in their life.
Exactly.
Maybe the interaction with their spouse,
Right.
maybe, newfound kind of attention
Right.
from,
Right.
just people that they haven't had before. So
Right.
yes, we would make referrals in cases like that.
Excellent. Yeah, because it can be dramatic.
Right, right.
What about in a case where someone wants to lose just that extra 15 pounds and they just can't do it? What do you do for someone minimal like that?
Well, they do have to be a certain they need to lose a certain amount of weight for the prescription
Okay.
appetite suppressant.
Okay.
Okay. And someone that is 15 pounds, may qualify for that. We
Right.
have to come in and have that initial assessment, but the herbal plan can work for anyone.
I see, okay.
So, and sometimes it's just really that diet change that is just keeping, that those 15 extra pounds that, are difficult for all of us
Right.
to get off sometimes.
And it could just be the accountability factor, let me go in and
Exactly.
talk with someone every single week.
Mm-hmm.
People
Right.
just like that comfort.
Right, and it's like, well, you have to get on the scale.
Right.
It's like, okay, now,
Right.
now we've got to, really step up and see what
Exactly.
you've done this week.
Exactly.
Right. How long do people typically stay on the program?
I think most of our patients typically spend about 3 to 4 months on the program.
Oh, wow.
Maybe, but the typical patient maybe has to lose around 50 pounds. But it's different for everyone. There's, that 80% bell curve where most of our patients fall as far as weight loss, but there's always outliers.
Right.
There are those people that lose tremendous amount of weight in a very short period of time. So it really just depends how closely they follow the program
Right,
outside
right.
the clinic and how motivated they are and how quickly their body wants to release that extra weight.
Right, excellent.
So I'm sorry.
Okay, I was gonna say, do you educate them like about food labels and sodium content and chemicals and hydrogenated stuff?
Absolutely,
Yeah.
definitely reading food labels. There's
Yeah.
so many ways that kind of hidden carbs and sugars and calories can get
Absolutely.
into the things that we add to our foods for flavor,
Right.
salad dressings, meat marinades, all of that. So
Right.
there is a component to reading labels, and we do give a specific parameter as to what should those labels say.
Right. Good. Oh, that's excellent. Because a lot of people, I mean, even some of the smartest people I've ever met, really don't understand the food label.
Exactly.
It's
And I
very
have a lot of
common.
patients who always say, I really don't eat much. I don't eat much.
But it's what they're eating.
Right, it's what
Right.
they're eating. The little
Right.
bit that they're putting into them is turning on their fat storing programs
Right.
or whatever,
Right.
whatever it is. And it's just an educational
It's-
thing.
yeah.
They can be in great shape, but
Right.
yeah.
I know a lot of people like that. They're in
Yeah.
great shape. They
Uh-huh.
work out all the time. They have trainers. I mean, they really work hard. But yet there's still that leftover fat, and they don't know why it's sitting there.
Well, for women, what we've seen a lot too is that it's more important what we eat, not necessarily how much we work out. Now,
Exactly.
of course, if you're going to someplace like The Biggest Loser and you have a trainer and you're
Right.
working out 6-7 hours a day, of course that's
Right.
different. But that's not the typical lifestyle. We may get 30 minutes of exercise in,
Right.
and maybe we burn about 250 calories.
Right.
But we can knock that out with a cheeseburger.
Exactly.
So,
Yeah, and you'll
so
be
there
adding,
you're back to
right.
square one.
Right,
Right.
exactly.
Right.
More like an Oreo. Yeah, right.
So how do people find you?
Well, I recommend they go to our website first. There
Yes.
are many great testimonials from patients, and they can learn a lot more in depth about our program. And they would
Yes.
just go to fitmedicalweightloss.com.
Excellent.
They can also call the Albuquerque office at 888-9575 or in Santa Fe at 820-7062.
Excellent.
Okay.
Good. Well, we'll take a break with
Yes.
Mary and
We'll be
Herman.
back in a few minutes, right? Mary and
Right back.
Ravon's going
Thank
to talk
you.
about skin
Okay.
tips, and then
We'll be
we'll
right
talk
back
some
with
more.
you, Lanya.
Okay.
Don't worry, you're not
Okay.
going anywhere. Okay.
Okay, well, you've been listening to Talk 1260 KTRC. This is our first segment on medical weight loss. This is Dr. Daniel Ronel. And if you have any questions about what Lanya said, you can call me too if you didn't get her number, and I can tell you about it. You can look us up on danielronelmd.com, and we have links to them. And stay tuned, we'll be back with more discussion about medical weight loss.